Hi friends, I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI. I'm a fertility doctor. And so talking about failed cycles is something I do every single day. And I know there's a lot of misconceptions when it comes to fertility treatments. And part of the reason why this channel exists is to help break it all down so that you can be more prepared for trying to get pregnant, whether you're just starting, understanding your body, or if you're doing fertility treatment like IVF or IUI. So please subscribe if you are interested and support us along the way. Now, when it comes to failed cycles, there's a few things that I think are really important to think of. And one is what makes it failed. And part of understanding what makes it failed is understanding what was the expectation. Because sometimes I see patients who come in for a second opinion when the outcome that they had was exactly the outcome that would have been expected. It just wasn't clearly explained to them, or they didn't have an understanding of that. And that is a part of the problem. There are too many doctors who are very paternalistic and they just tell you you need IVF and they don't explain your odds of success or what the entire process is going to be like. So, for the most part, when we talk about failed cycles, we usually mean not getting pregnant. But when it comes to IVF, it can also mean maybe not making embryos or not having any normal embryos. So, when we think through it, let's break down a couple things. So, for IUI, right? IUI is intrauterine insemination. This is when you're taking sperm and you're putting it into the uterus instead of having it in the vagina where it normally is. Now, of course, the vagina is an acidic environment, and so the sperm is in this ejaculate in order to protect it. And so you do have a concentrated sample, and moving it into the uterus can help some people get pregnant. IUI, even when you combine it with medications to improve or to increase someone's ovulation, is not going to help somebody ever get pregnant over their age-related chance. So whatever your age-related chance is, that's your maximum chance of success with ovulation induction and or ovulation induction IUI. So when it comes to a failed cycle, most of the time we mean we did the cycle and we didn't get pregnant. However, sometimes it can mean like if you're doing ovulation induction that you didn't respond right and so you failed it because you didn't respond. So I always counsel people, goal one is to have an appropriate response to the medication in our goal range, whether that's 1 to 2, 1 to 3, 1 to 4, 2 to 4, whatever our goal number of eggs is to make with the medications, that you're achieving that. That alone might be a successful cycle. Now, if you don't get pregnant, well, if you're age 37, you're not going to have a higher than a 10 to 12% chance of it working. And so the most probable outcome was that the IUI did not work. And if you're upset because the cycle failed, part of making sure it is framed right is, well, that was the most probable outcome. That's why often people need multiple IUIs and that it's more successful for people who are younger because their age-related chance of getting pregnant. So to me, IUI didn't necessarily fail if you responded appropriately, the sperm looked good, you just didn't get pregnant. That was an expected outcome, and understanding how many you're going to do and your chance of success is very important. More often, we're talking about IVF, right? And IVF is very complicated. So, for the vast majority of people, IVF is now done in two parts. So, when we think of IVF or in vitro fertilization, in general, we're taking 1 month's group of eggs, getting them to grow, taking those eggs out of the body, fertilizing them in the lab, growing out to embryos, and freezing the embryos. We may or may not be doing genetic testing. Then we are doing a frozen embryo transfer, which is where we take one of the embryos, thaw it, put it in a catheter, and put it into the body at the appropriate time. Sometimes these can be done together, and that's considered a fresh transfer, where you get the eggs out, fertilize them, let them grow out, take the best